Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the Tea. Tea Time with Dr. Tarver is a wellness based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Welcome back to the second month, the the second week of June, as we are celebrating Pride Month and focusing on a series entitled We Deserve, because we do. We deserve all of the things such as safety, respect, to be seen and heard, to have responsive and affirming appropriate health care, and to have legislation that allows us to be a diverse set of people and get what we need. So last week I discussed safe spaces for the LGBTQIA plus community, and this week I am going to be discussing affirming mental health care services. Now, as a mental health provider, I hear a lot of reasons why people choose not to seek therapy. And that can include past negative experiences. Sometimes in our lives, we're mandated to go. There may have been an accident that occurred, a vehicular accident that occurred. Somebody was under the influence. They're mandated to go to treatment. There could be mandated treatment for parents who are involved in custody disputes. There's mandated treatment for people who may have substance abuse issues who are trying to return back to work. There may be mandated treatment for even our young people because maybe there's some truancy at school, or academic performance has decreased, or perhaps there's been incidents where there's been challenges with other students or educators in a facility. And so, what we know about when we're forced to do something and we're not ready or we don't see the value in it, it doesn't usually go that well. And so, sometimes for people, if that's their only experience with therapy, then they have a very narrow approach to what therapy could look like. But then there are also people that did attempt therapy and maybe they didn't connect with their therapist. Maybe they didn't feel seen or heard or valued. Maybe they felt judged. Maybe they were looking for particular things from therapy they didn't receive. Sometimes people feel as if they're rehashing, but they're not actually progressing. I hear that a lot in couples therapy because when often people start couples therapy, they're not in a really great place. So early on in therapy, it's very hard. And a lot of people tend to drop out during that process because they feel like, what's the point? And we also recognize that when people are in a place where they're going to couples therapy, they're not in the best place, and so sometimes people are already pretty much out the door by the time they come. Um, but also, the therapist approach could include something that we've learned is damaging. Conversion therapy is one of those things. There used to be a time when people actively tried to tell people to change their sexual orientation. That's not who you are. You can pray your way out of that. You can resist these urges. God is going to see you through this. And for some people, unfortunately, they really tried to be who they weren't. And think about how damaging that would be for a person. And to feel like they weren't strong enough, they didn't have enough faith, um, and to feel like they were rejected by God and unloved. And so here are some of the reasons why you can begin to understand why the suicide rate is so high in LGBTQIA plus populations because of that lack of affirmation. Also, there could just be a negative experience or a negative perception of what could occur in therapy because if you watch a lot of TV shows or movies, you will see very inappropriate things occurring from the therapist, such as them having sex with their clients or them being with their clients in settings where they're trying to manipulate environments for them or trying to scare them or trying to force them to do things. And so, if that's your only example of what therapy looks like, then it's definitely not a reflective of the field, but it's what you know. Sometimes people just don't understand how therapy could be beneficial for them. Like, oh, I'm not that bad that I would need therapy. Or I have friends that I can talk to or family that I can talk to. What would a therapist be able to offer me? I know myself better than this therapist. What could they tell me? I'm not crazy. I hear that a lot, even though crazy has never been a diagnosis. So I think there is the challenge with I think a lot of times how people perceive what therapy actually is. And if you haven't actually had a consultation with a therapist or been in a space to be able to see what we do, then you, of course, are going to base that information on what other people told you or what you've seen represented poorly in media. Sometimes just people aren't able to afford therapy. And that can be a barrier for people accessing care, or if they take advantage of some of the low cost, no cost services, they don't feel like they're getting good therapy. They feel like they're just kind of going through a meal system, like, oh, okay, people are checking off this box that they're offering this free or low cost therapy, but I don't feel like I'm getting good quality therapy. And then, having access to therapists, a variety of different types of therapists, culturally competent therapists, affirming therapists, people who look like us or have shared experiences or who are allies can be very important in terms of how we perceive the therapy experience, because we know that the therapeutic relationship is one of the most important components of successful therapy. If I don't feel like this is a safe space and I don't connect with this therapist, it's going to be really difficult for us to be able to get any work done. So I want to talk about what to look for. What is affirming therapy? How does a person access it? Um, so I mentioned the American Psychological Association. They are our guiding framework, if you will, for how we practice in this field. And so a task force was created to actually address the guidelines for psychological practice. Their wording is sexual with sexual minority persons, LGBTQ IA plus, right? And so if you're looking for a therapist, here are some of the things that I think is important for you to know. A therapist who has been adequately and appropriately trained is going to understand that there are diverse sexual orientations. We're on a continuum. It's not black and white and dichotomous. And sometimes, because of our biases, we want people to fit in nice, neat boxes. However, we understand that that's not the case, and that sexual orientation intersects with a variety of other identities, including gender identity and expression. And sexual orientation and gender identity expression are different. We talked about that last week as I was giving some definitions. And that we want to affirm these different identities that people have and examine the biases that we have when, again, people don't fit in these nice, neat boxes, right? Because we are not as affirming of identities collectively as a people as we are of individuals who might identify as having a preference in just males or females, a very, what we like to say, monosexist kind of approach to, uh, our orientations, right? And so we understand that just because a person doesn't identify as something that we've been taught was comfortable or acceptable, we know there's a lot of bias that has brought out, unfortunately, in religious contexts, and that is frequently used to ostracize and separate and marginalize people. That orientation that is LGBTQ, and all of those aren't sexual orientations, so I'm going to stick with the terminology sexual minority orientations. So our LGBs are not mental illness. And anytime we attempt to try to change someone's sexual orientation, that has the potential to cause people harm. It's also important that we understand that stigma does exist, discrimination does exist, and there is stress related to sexual minority orientations. We understand that there are a lot of different types of relationships people can be in, and that includes parent child dynamics, family of origin dynamics. We understand the importance of sexual health, and we also understand the influence of our educational systems and our workplaces. We recognize that because there is bias that can exist, there is discrimination, there is stigma, it is very important that we address these things in therapy. How a person is being affected and how they're allowed to be able to develop as a result of some of those isms. And it's also important for a culturally competent and responsive therapist to be current on research, because research is ever changing, growing, we're learning a lot. So we don't ever want to get to a point where we think we haven't learned. There's plenty of things I don't know, right? Which is why it's important for us to have a good understanding of a referral basis and recognizing when something is outside of our scope. And frequently, If you will have a consultation with a provider, you can simply ask those questions. And so let me give you some examples of some things to ask. Do you want a therapist with expertise and training in a particular therapy approach? There is affirming cognitive behavioral therapy, right? There is cognitive processing therapy. There is, excuse me, exposure therapy for people who have experienced trauma. So there is a wide range of approaches that a therapist can take. And so you might want to kind of do a little research on your own. What am I experiencing? What's going to be important for me? Do you want a therapist who has a certain gender identity that you would feel more comfortable with? Do you want a therapist who is experienced in treating certain conditions? Right? Maybe you've had a sexual assault or abuse. Maybe you have some substance abuse issues. Maybe you're dealing with depression, grief. Maybe you're having suicidal thoughts. Right? Again, maybe you have had natural disasters or incidents at school. And so you want to ensure that this person has training in that area. And these are all appropriate questions to ask. I think sometimes we feel like we're a bother. We don't want to be intrusive. They're not going to take the time to answer this. But I will tell you that any therapist who you want to see has a few minutes to take with you to answer these questions. Now, do understand that we do not have an hour to spend with you answering questions in a consultation. But it is very important that you're mindful of your time as well as our time. And so, yeah, have your questions that you want, allow them to be answered. And do know that even in your first appointment, that doesn't mean that you're for certain going to stay with this person. That first appointment can also be an opportunity. Take some time to develop a relationship. We're gathering a lot of history in the first couple of appointments. And so it may take you several appointments to even really get into this relationship to be able to make a decision about whether this person would be a fit for you. So don't feel like you have to get all your questions answered in that initial consultation. Now, I say people won't sit with you for an hour. They might, but they also might charge you for that hour. So, again, just being mindful of people's time. Um, would you feel comfortable with someone who was not a member of the LGBTQIA plus community? Do you want somebody who has experiences firsthand, or you want somebody that is educated and an ally, but they don't necessarily have to identify as LGBTQIA plus? And are you comfortable asking that question? Maybe somebody is not necessarily um, expressing that on their website, but that doesn't mean that that's not their identity. And there are people that express it specifically on their website, right? And so we want to be also thoughtful about our own biases. Like, wait, hey, am I maybe possibly trying to get information from this person? We haven't even built up a relationship yet, because that could be a determining factor. And that doesn't necessarily mean that they're any more qualified, but it may contribute to a variety of different things when asked with other questions, right? So these are some of the things you want to figure out. And that's why, again, that initial consultation or even in that first appointment can be very important. Do you want a therapist who shares other aspects of your identity and who understands how they can intersect? Right? And this is when we look at the culture piece. This is when we look at spirituality. This may be look at you're a parent. This may be somebody who has background with college students. This may be somebody that's back again trauma. Like, so all of these things are really important. And oftentimes you can read a person's bio and get some information. And so I definitely encourage you to do that as your first point of contact. Most people have a website that has information about them, whether they're a part of an agency or they're working independently. And so you can glean some information from them from their website. So you take the information that maybe isn't present, and that's what you want to focus on, particularly if there may be some specific things that you're dealing with and you want to make sure that this person can address them. We know that there is a lot of virtual therapy now. So you can see a therapist on video, which, is one of the things that helps if you're in a rural area or you don't have access to a variety of diverse providers. You now can access anyone in the state. And so that can be very helpful for you. Or a lot of therapists who have the e-passport are able to practice in a variety of states. And that is something you can ask as well, because you want to make sure that your provider is licensed to be able to see you where you are, because that's what's important, where you reside. And if they have a license, that'll cover that. And most providers will ask you that information up front, but that is something important to check. It's also important to check to see if your insurance plan covers online therapy. We are now seeing, I can't even say now because some of them reverted back about a year ago, where they may charge a different copay or have a certain amount of coinsurance that they pay for an in-person visit versus an online visit or virtual appointment. And so you definitely want to make sure that you are checking, because that can make a big difference, right? As in terms of if in person would be at no cost to me versus if I do telehealth, your online therapy, your video appointments, then that would be at a cost to me. And am I in a position to be able to afford that? Also looking at, for some people, you're employed in places that have an employee assistance program. And so there may be the option for you to get 8 to 10 sessions covered at no cost to you through your job. And so do we have some people that accept the EAP that are also able to meet the criteria that I'm looking for in terms of affirming therapists? You may not want to consider online therapy if you're in a state of crisis, right? And so if you have immediate help, you're in immediate crisis, a danger to yourself or to others, struggling with medication management, um, that may not necessarily be the best option for you. And it also is just really important as you think about mental health, whether it's with a licensed professional counselor, a psychologist, a licensed marriage and family therapist. There are a lot of different terminologies that are used based on the licensure in your state, or a psychiatrist. It's important for you to understand what you need in that moment, because maybe you want an in-person therapy experience. Maybe you've tried virtual or you haven't, and you're not really sure, but you're thinking that you would prefer in-person over telehealth. It is absolutely appropriate for you to say that. It's not offensive to us. We're not going to be upset if we only offer telehealth and you're interested in person. We'll do our very best to get you connected with some potential options for in person. Now, that can be a challenge with regard to geography, depending on where you are. So, if you want a affirming therapist, but there aren't any, excuse me, within a 20 to 30-mile radius of you, may be a little challenging, or if you don't have transportation. So that's when telehealth might be better for you. If, transportation is an issue, you don't have anybody close by that you would be able to access easily, then that might be when telehealth is a good fit for you. Or if you don't have a preference for video versus in person, or if you actually prefer telehealth. So those would be opportunities, but the same things still apply. You want a LGBTQIA plus affirming therapist, whether that's gender identity or sexual orientation, the intersection of different identities, how they approach therapy, being able to have that good fit and connection with them, feeling like it's a safe space. It's going to be a space where you're able to get your needs met. They're competent in the things that you're dealing with, that you're bringing to the therapy experience. So, how do you find a therapist? Well, there are a lot of different options. So, on the LGBTQ plus healthcare directory that's offered through GLMA, and I talked about them in our episode last week, but I'll drop their information as well. The Health Professionals Advancing LGBTQ Equality, they have a directory through which you can access LGBTQ plus affirming therapists. The Therapy Den is an online therapist directory that features profiles from therapists all over the United States. So you can specify um, what you're interested in, whether or not you'd like to be like for the therapist to identify as a member of the LGBTQ plus community. It can specify their gender identity. You can look at transgender, non-binary, genderfluid therapists, and so it's a really good resource with regard to. And again, it does matter where you're living and where that provider is licensed. But that's a good option for you to be able to find a good fit for you. Therapy for QPOC, therapy for queer people of color, also has a mission to connect queer and trans people of color to affirming anti-oppressive mental health professionals. And you can specify your preferred gender identity from 15 options in their database. We also have inclusive therapists, and they provide accessible and affirming care for marginalized identities, including those based on race, gender identity, sexual orientation, neurodivergence, and disability. And you can filter your search based on their specialization in those areas as well as their identity. Pride Counseling, I mentioned them last week as well. It's an online therapy option. And for some of the other resources that people I often refer to, Psychology Today, therapy for Black girls, you can also go in and specify some of those characteristics that you're looking for as well to be able to utilize those. At the end of the day, what's important for you to know is you deserve to have a safe, affirming, therapeutic environment. And there is a therapist that is going to be a good fit for you. It's just a matter of you reaching out to that person, asking those questions in that consultation, and finding your match. Be well.